Good morning, everyone. Thank you for joining us here this morning at the GTHA and 4S's COVID-19 Safety Plan webinar. For those who do not know me, my name is Emily Dixon. I'm the Director of Executive Office Programs and Events here at the GTHA. And today we have the pleasure of working with 4S to walk participants through creating their own safety plan for COVID-19 for your hotel. As I'm sure you're aware, a written safety plan is required by government under the Reopening Ontario Act. And the main focus and purpose of the plan is to keep your guests and your employees safe. If you didn't get the downloadable template yesterday sent via email, it is available in the chat. We encourage you to download it. The whole point of today is to go through it with our panelists 4S to, at the end of the session, have a full safety plan in place for your property. So you're aware this webinar is being recorded and will be made available to all GTHA members. There's also a question and answers box, which we encourage you to use throughout the webinar. If you have any questions, feel free to ask throughout. If for some reason we don't get to all those questions, feel free to email us at the GTHA at info@gtha.com, and we can address anything that you might have relative to the safety plan or anything else that we could assist with through the planning process. Now, without further ado, I'd like to introduce the 4S team. We have Adi with us here today, who's going to be walking you through the COVID-19 safety plan and creating the draft. He's an experienced marketing specialist for 4S Consulting Services, who are the official health and safety partner of the GTHA. 4S is a provider of occupational health and safety consulting, training, and online management software, and they deal directly with the Ministry of Labor and the Chief Prevention Officer on a regular basis. We also have here with us today Kesav, who is the marketing specialist for 4S and will be facilitating the webinar from the back end. So I'd like to say thank you very much for joining us here today. And without further ado, I'm going to pass it over to Adi. And again, if you have any questions throughout, please use the question pane. Please make sure you've downloaded the template, and off we go.
Thank you very much, Emily. And I'm really glad to see the numbers going like a taxi meter there, people registering one after the other and logging in. So really excited with to introduce ourselves and to be part of this partnership, this amazing partnership with the GTHA. Thank you for the introduction. So the webinar today is all about, like Emily rightly said, COVID-19 safety plan. It is a requirement. If you're open under the Reopening Ontario Act, the ROA, as it's popularly known, you need to, it's mandatory now. It is not a good to have anymore. It's a must have if you're open under the ROA. So what we have done is we are here to enable you and help you to understand the various aspects. What's the context of this whole webinar? Let me set the context right. We are here to understand the critical aspects of a COVID-19 safety plan. And I'll be taking you through each of them and what are the best practices and what are the best ways in which you can supply information and use this as a very powerful communication tool while complying with the ROA requirements and the Ministry of Labor requirements as well. So this session is divided into two sections. Section one is your COVID-19 safety plan. I'll be taking you through page by page. So I would highly recommend you to click on the link on in your chat box. It's a Dropbox link. When you click on that, you'll see a screen which allows you to download the Word file. So you can go to the top right of your screen. You'll see the bottom pointing arrow, which is a representation of a download button. Click on that download button and please download that. Have a pencil in hand, start annotating, have a draft COVID-19 safety plan ready, just like Emily said. Crucial for that, for you to do that. You can go and review it with your team, respective teams in your hotels after the webinar. That's the whole idea of having this webinar. So time to get a nice cup of coffee in hand and get the COVID-19 plan up and running. So let's move on to the next slide. Why is OHS, which stands for Occupational Health and Safety Compliance, significant for employers? I don't need to tell you that, it's a no-brainer, but let me just quickly give you the four major points. Your safety of your employees. First and foremost, corporate branding, both positive and negative. What I mean by positive is your hotel being viewed as a safety conscious customer, both by your a safety conscious brand rather, both by your customers and by your employees. That's a big win-win for you. And any negative publicity, as you know, any infractions can be published in the court bulletins of the Ministry of Labor Training and Skills Development, that you can, which we can avoid. And due diligence, occupational health and safety due diligence, you need to prove it. And most important of all, to stay open, you need to be in compliance. So let's jump straight into the action. And before we just get into the COVID-19 safety plan, let me quickly take you through some data that we gathered from the Ministry of Labor Training and Skills Development, which is popularly known as the MLTSD. This is for the restaurant sector. Let's start off with the restaurant sector. During the period that was mentioned there, all I want you to see is and understand is out of the top 10 orders that were issued, 169 orders were for the section under the Occupational Health and Safety Act for employers called 252H, which stands for taking every precaution reasonable in every circumstance. It's for COVID-19 infractions, like not having a safety plan in place. And if you look at the breakdown of those orders, screening requirements, physical distancing, masks, cleaning, disinfecting, and various orders issued for not related to COVID. So if you look, these are nothing but elements of the COVID-19 safety plan that I'll be taking you through. So just imagine by doing your draft or keeping your draft ready by the end of this meeting, you're going to be covered under all these compliance requirements. I just wanted to bring this data for this tourism and hospitality and recreational. If you look at the top 10 orders, 71 for COVID-19 infractions. And out of that, again, 48 for screening requirements. Screening is a very basic part of the COVID-19 safety plan I'll be taking you through, so you'll be covered. So just wanted to bring that to your attention. And some multi-ministry data for the food and accommodation sectors. Again, safety plans. 826 orders were issued in this particular sector for employers not having a COVID-19 safety plan in place. Why are we bothered about it? We're going to have one at the end of the session. So let's jump straight into section 1, COVID-19 safety plan. And before we jump into the plan, some quick instructions, this basic stuff like most of you would have downloaded the thing by now, the COVID-19 safety plan. And the document has 9 pages, and you can start by printing your company name and details. I'll be taking you through all that in a bit. And there are lots of blank spaces. And the idea of the blank spaces is for you to try and ponder over who could be that person, who could be the accountable person. So I'll be taking you through all of that and some few resources for you. And one of your biggest and the best resource for you is GTHA, your association. So GTHA has come up with a COVID-19 resource link, which my team will be placing in the chat box any minute. I would request my team to do that, and it should be in your chat. Please visit that link of GTHA and take advantage of as much information as you could gather as possible. Let's now get into the first page of your COVID-19 safety plan, page number 1. I'll give everyone about 3 to 4 seconds to try and assimilate the information that you see here in the first page. Business name, name of your hotel, completion date. You would argue, how can I say what a completion date is? This is a draft plan. It's a draft. So you can definitely put in your completion date as today. What's the harm? You can go and amend it once you go and review it with your team. Communication date. You could put it as today. Okay, September 29, you completed your plan, you communicated plan on, okay, if not today, maybe October 1st, have a date there. You need to, communication date is the date on which you communicate your safety plan, or you plan to communicate your safety plan to your external customers, real customers, and internal customers, your employees, your staff. Revision date. Again, the date you revise your draft safety plan. Let's say your completion date is today, since you're doing the draft today. Let's say you you go and review this with your hotel or with your management teams, respective teams next week. And based on your discussions, there's a revision that happens on October 8th. That's your revision date. Safety plan developed by, If you're the health and safety representative of your company, if you're the joint health and safety committee member, that's the person. You're the person. The safety plan needs to be developed by either the joint health and safety committee member, or by a health and safety rep, or by a supervisor, senior manager who's accountable. And the consulting member, just mention all the names of your JHC members and your health and safety reps if you are less than 20 employees in your hotel. That's as far as page 1 is concerned. So I hope you've got some of the data filled out for page number 1. So now let's jump straight into the key elements of COVID-19 safety plan. There are 3 key safety plan. And what are they? Screening, communication, and control measures. Simple as that. You need to have your screening protocols in place, communication protocols in place, and control measures in place. Let's understand. So let's understand what is screening. Let's all go to page number 2. I want all the participants on this call to move over to page number 2, please. Page number 2 is the page where you fill out all your requirements for screening. This is your page where you tell your customers, internal as well as external, about your screening requirements, your screening protocols. How are you planning to screen and stay on top of the pandemic and try mitigate the risk of spreading or an outbreak? So this is your section where you're going to be mentioning all your screening. So 2 major stakeholders, your staff members and customers. Screening is nothing but, if you ask me honestly, it's the set of those boring 7, 8, or 10 questions. I call them boring because we do it every day. And it's almost like, today they ask you, did you go out of Canada? Did you travel out of the country in the last 14 days? So I was at the office yesterday. So there is no way I would have traveled somewhere. So yeah, at the end of the day, it's a requirement. Those are your screening questions, and that's your screening protocol. Let's now jump into the screening requirements for your staff members. That is page number 2, the same page. So what do you do here? In this section, you tell your staff members, when you communicate your safety plan to them, this is the section where you say what they will be doing, who will be the person accountable for completing the screening tool, who will need to do the screening, who will need to manage the screening. Understand and identify either managers or supervisors. Accountability is the key to health and safety. Be it a COVID-19 safety plan or your occupational health and safety program, make sure you have people accountable who are watching whether the COVID-19 screening tool is being filled out. But what's the use of having a screening process if people are not filling out the screening, using the screening tool and filling out the screening forms? So accountability could be through a position. You can either say either a manager or a supervisor can do it, or Emily, Mary, Addie, Keshav, or a person can do it. So identify a name of a person or a position. And once you do that, make sure that the person, the manager or the supervisor accountable will ensure all your staff members have filled that out. And someone who fails or forgets, they're given reminders that this is crucial and there's a reason why we are doing this. It's for your own safety and for everyone else's safety, and to mitigate and to save and to protect the community as well at large. Managers and supervisors need to keep records of what's being completed, and in a couple of slides I'll be showing you why, because there is a requirement for you to store the records for a certain amount of period, because if there is, God forbid, an outbreak, ministry will be visiting, the authorities will be visiting. So you need to be able to furnish your COVID-19 screening records. So ensure that your managers or supervisors keep a record, and then managers, supervisors on duty will have to ensure all work-related visitors are screened as well before commencing their work. So that's a basic, that's a no-brainer again. And Dash will ensure all records of COVID-19 assessment are filled by work-related visitors for 30 days. I was just telling you, you require it, You're required to maintain your records for 30 days, but who will be recording it? Who is accountable? Do you want a supervisor, or do you want a manager to be accountable? You want a position to be accountable, or do you want a person to be accountable? Like, do you want Emily to do it? Do you want Mary? And these are just examples of names, obviously. So if you want Mary to do it, you want myself to do it, or you want someone in your restaurant to do it, you decide who that person is going to be, because that's crucial. And then ensure that the person is doing that. Let's go to page number 2 of the COVID-19 safety plan. Can everyone turn over to page number 2, please? We are still on the screening customer section of your COVID-19 safety plan. And here, all your customers will be asked for COVID-19, all the COVID-19 screening questions. This is where you're going to be asking them all the basic questions that I'm sure all of you are aware of, that we've been answering day in and day out. So contact information for all guests seated will be recorded and stored for 30 days. Again, 30 days is a requirement. So ensure that the person that you've identified as the person accountable, a manager, a supervisor, manages their records. However, I keep saying this, occupational health and safety program or COVID-19 safety plan should be made sustainable. What do you mean by sustainable? Is if it should not be as good as the person writing the requirements or writing the plan. So in case a supervisor is unavailable, another supervisor will be responsible for these tasks. Put it on record. Let people know that if a supervisor is not available, it's not, no one's going to drop the ball on it. We are a responsible employer. We are responsible for the safety of our employees and the community at large, and the customers. So if one supervisor is not available, who's the other person? Another supervisor, another manager, a team leader. Identify who that person accountable is and ensure the process never stops. If someone's unwell, who is the other person who's going to do that on shift? Keep that in mind. Let's all move in to page number 3 and 4 of the COVID-19 safety plan. Now that we have taken care of the screening for customers and screening for the employees and the staff members, let's now try and look at the communication aspect of the COVID-19 safety plan. It's one of the 3 critical things, right? Screening, communication, and control protocols. What is communication? Communication is simple. Communication refers to the knowledge sharing with your existing staff, clients, and customers. So both internal and external communication. So that's the 2 types of communication. So in page number 3 and 4, you will be talking about different aspects of what you'll be doing in internal and external communication. Let us all move to page number 3 of the COVID-19 safety plan. You'll see a lot of fill up the blanks. Trust me, this is not an exam. We are done with all that at school. However, this is a slide where I need each one of you on this call to be attentive and start thinking about who that person is. Put in a name. Who do you think is the person who's going to be communicating or emailing the plan to all your staff members, workers, and employees? Do you think Emily needs to do that? Emily is responsible for your hotel, let's say, and John is responsible for updating or the staff bulletin board. Then Adrian is responsible for sending out weekly, monthly reminders to the members via email and keeping them updated with essential developments. And let's say Keshav's good with social media, so he needs to be updating the social media communications and other things. So who's going to be doing all of this? It could either be a name of a person, if you're sure that person is going to be doing it, or it could be a position. Supervisor, on-shift supervisor is going to be doing it. Team leader is going to be doing part B. And let's say a senior worker could be, if in absence of a team leader, a senior worker could be doing something else. Again, whatever you mention here, think about it quickly. I'll give you about 4 or 5 seconds. It's an important slide. Ask yourself questions. Who is the person responsible in my hotel doing this? And there's a reason. When you have people accountable, when comes the right time when unfortunately there is an outbreak or there's a Ministry of Labor inspector visiting your place or a ROVA inspector visiting your place, you know who to go to. You will not run around all over the place in circles. You'll know, hey, why don't you have a seat? You want a cup of coffee or something? Emily, can you get me the list of all the screen communication that was done? And John, can you get me the screening records? That is why making people accountable is crucial, because A, it helps you fill out everything properly and have processes in place, and B, it makes it easier for you to prove due diligence, which is crucial, and which is why you need to have your safety plan in place. So I've given you enough time to think about it and start filling this out. And just let you know, this slide deck will be shared through Emily with your entire team. All the attendees will be shared through the GTHA marketing channels, and they will be receiving this as well as the COVID-19 safety plan again after the webinar. So just to keep you posted, so if you have missed anything in a slide, do not worry, you'll be seeing it again. Let's now go to page number 3, everyone, of the COVID-19 safety plan. Again, lots of fill in the blanks. Let's try and understand what you need to do in this section. Very simple. You need to understand who will be the person in charge for updating information. This is your section of the plan to communicate that to your employees. Who would be the person responsible? Let's say Emily is in charge of the official government website updates and finding out updates every Monday from the Ontario.ca website. So make Emily accountable for that. Or if it's a supervisor or a senior manager, it could be a position. It need not be a person. You can make it a position. Let's say, who will ensure that all the COVID-19 information generated is clearly understood? Because Ontario.ca and Ministry of Labor Training and Skills Development understand that the information could be very technical, very act specific. How do you, without changing the meaning of that information, make it easier for your staff and your customers to understand, instead of looking at it a legal way, make it easier for everyone to understand? Who's going to be the person doing that? Identify that. And make your managers or supervisors, whoever, decide who is going to be that person, make them accountable for that, because updating information holds the key. I'm sure all of you know this, and Emily, being a member director for GTHA, can vouch for it, is week after week information is changing. And there was a time in last year, information was changing virtually every second day. So what's good today may not be good in a couple of weeks from now. So make sure you stay on top of all the changes and keep updating your safety plan. And that revision date I told you is the date on which you make any changes to your plan. Simple as that. You can make umpteen changes provided they are relevant and significant and will help build more awareness. Let us all now move to the next page of the safety plan, where we talk about the training. Training is one of the most potent tools for you as a hotel to ensure that your staff is right on top of all the COVID-19 safety requirements. This is your section of the COVID-19 safety plan to tell your staff and to your external customers what you do in terms of training your staff. And what are your protocols like? What are your protocols on personal protective equipment, washing techniques as per government guidelines? How are you training your staff on that? How are you training your staff on identifying symptoms for COVID-19 and taking necessary actions? What are your strategies for self-assessment and isolation? Then how are you training them to observe their symptoms and stay at home and report to their managers? It's all about telling people that, look, we care for our people and we care for the community at large. We want to keep you safe. We want to keep our people safe. We want to help the community. We want the hotel industry booming once again, back in action. And that is why training plays a very crucial role. And what are your training protocols for complying with the mandatory screening requirements and infection prevention? How are you training your people on disinfecting workplaces? A lot of your staff will be cleaning the tables, disinfecting areas. It could be a manager, it could be anyone doing it. How did you train them? Do they have the proper PPE? Do they know how to use these equipment? So it's crucial for you to do all of this. And this is your section to mention all of that to your employees and to your external customers. Let's now go to page number 4. I want everyone on this call to move over to page number 4, where we talk about the external communication. Okay, you've communicated everything to your internal staff. Your staff is now right on top of your COVID-19 protocols and requirements. They know exactly what they need to do, how they need to keep themselves safe and keep their external customers safe. However, communication plays a major role with the external customers. I was having a conversation the other day with my teammate Keshav about how do you choose a hotel or a restaurant when you, it was his birthday last week. So how did you actually choose one? It's just simple. Go on my mobile phone, look at the Google reviews, look at the reviews, look at how the ratings for the hotel, look at what the customers are saying about the experience. That's how important it is living in today's digital age, the social media era, to update your social media handles, okay? And write about what your COVID-19 screening requirements are. How often do you think your customers will read your COVID-19 safety requirements on social media? Of course, they will visit your COVID-19 safety resources. Of course, they will visit your website. Of course, they will look at your Twitter handle, your Facebook. Trust me on that. They're going to go there. They're going to watch your hotel saying, this is what we are doing to keep you safe. Please come and visit our hotel. Please ensure you do A, B, C, D, E before you come to our hotel. We are hospitable, but we want to keep you safe and our community safe. So this is your section. Again, it ain't good if it is as good as the person writing it. Who is accountable for it? Ensure you have either a senior manager will be doing all the important notices and government regulation updates. They'll be sending it through to everyone. It could be a content manager who will be sharing the periodic updates, a social media manager, or do you have someone who's a PR manager who will be updating your website? Identify who's going to be doing what so that you're not going to be running around in circles. In case you want to evaluate how this process is working, you know who to talk to. You don't go to Emily for something that is done by John, and you don't go to Adrian for something that's done by Keshav. As easy as that. Just you're on top of your program. And then more importantly, if A is unavailable, who is your plan B? Make sure you have a plan B. The plan should not go with the person making it. Let's now go to page number 5 and 6 of the COVID-19 safety plan. But before we go to page number 5 and 6, there seems to be a question in the Q&A box. And what I'll do is while I take the question, I'll go back to the previous slide and leave this open and everyone to ponder over their external communication strategy. The question is, in a hotel setting, is a restaurant required to have their own specific safety plan separate from the hotel plan? Interesting question. Restaurant must have, see, at the end of the day, hotel has its COVID-19 safety plan. But is it being advertised? As long as the hotel COVID-19 safety plan, Emily, I'd like you to feel free to join in and support me with this. As long as the hotel group at large covers all its restaurants, saying the restaurants follow this particular protocol, all our restaurant group in our group of restaurants follow these protocols mentioned in the COVID-19 safety plan, which is advertised at the notice board outside the restaurants. When people come and they'll see it, I feel it should not be a bad idea. It should work. However, no one stops you as a restaurant to have your own COVID-19 safety plan as well, provided you get approvals from your managers and your the group owners. If they would like to you to go ahead and have your own safety plan as well and protocols, go ahead and do that. But that's something more internal you can discuss. But as long as the hotel safety plan covers all the aspects for the restaurants, and that's clearly mentioned, so that I, as a customer, when I visit, I see that, oh yeah, the corporate group plan clearly tells me that this restaurant is covered under that plan. I'm okay as a customer visiting that hotel. Emily, would you like to add anything to that?
No, I think that sums it up. I mean, when we're looking through, as we continue to move on, page 5 specifically starts speaking a little bit about the number of guests per table, how many indoors, how many outdoors. Depending on, you might have an internal breakfast area that's separate of, for instance, your actual restaurant. If there are differences there, then you should have different pages that reflect those differences. For instance, I'm just thinking of the Delta South Core downtown. They've got an executive seating area for breakfast that you can use, and then they've got the SoCo restaurant. Those are going to have very different capacity limits. And if that's the case, then there should be different plans in that place. You wouldn't need an entire different plan, just the 1 or 2 pages that pertain specifically to the dining sections, which we're about to go over.
Tweaking is what they call. Very well said. You need to tweak
your
plan accordingly. So I'd request my team to actually switch on Emily's video if possible, please. Thank you so much. So let's move on to the control measures. Page 5 and page 6 of the safety plan. Everyone on this call, thank you very much for the question. Please keep asking as many questions as you can. We are here to help you. We're here to talk to each other. If we had to do that, we have telephones. Emily and I can have hours of conversation, but we are here to support you. We understand the pressure your industry is going through. And we, as an occupational health and safety expert, are here to help you go through various aspects of this COVID-19 safety plan, sharing some of our experiences, making life easier for you to comply as you see those infractions. All of them are COVID-19 safety plan elements related. So screening is an element related. If you have your screening protocols in place, do you really think you're going to feature in that list? No way. You're not going to be featuring in that list if you just take care of your COVID-19 safety plan requirements. Let's go to page number 5 and 6 of the COVID-19 safety plan, as I see questions coming in, which is excellent. What are the control measures? You've understood the screening requirements, which is one of the major three major tools of the safety plan. The second aspect was communication. You've taken care of that. The third one, control measures. You've now put in your screening requirements in place. Your external and internal customers know your screening requirements as per your plan. Your customers and your staff know your communication protocols. Now it's time for everyone to understand, first of all, your internal staff to understand your control measures, as well as your external staff. Control measures are nothing but basic actions that you take to reduce or remove the potential of any exposure or risk or a hazard. Let's all move to page number 5 of the COVID-19 safety plan. When you look at this page, lots of fill up the blanks. So it's not Addy time, it's your time. Please, I would request everyone on this call to download, if you have not downloaded the plan by now, download it even now, and it's okay, or just take a page on the side and start thinking about who are the people accountable for each of these aspects, control measures and physical distancing protocols. I'll give you a few seconds to just assimilate the information. I'll be taking you through each of them. While I see that there is a question that any hotel's asking guests for vaccination records, gray area. I would really say gray area, and trust me on this, and Emily can hop in, she's free to do that. Vaccination is a very tricky area, and neither the association partners like GTHA nor health and safety experts like 4S, nor industry leaders such as you on the call are very clear about it, including the government. So it's a tough one. There is no, we don't know anything as of now. So what we can do is we'll have to
let me step in there, Addy, because we do. And we have a great question and answer document, which is on the GTHA website. So I'll be happy. I see who the question's coming from. If you want to connect with me directly afterwards, we don't want to get too much into the vaccination passport concept on this call today. But the long and short is a guest renting a room is not required to show proof of vaccination because a room rental is considered essential. If you're looking at a guest coming into the property and then dining in a facility, they would be required under the new legislation to show proof of vaccination. So it's all about these entry touch points, whether or not it depends on where you decide those touch points are. So again, if you want to connect with me directly after, I can provide you some more information on that. But I hope that kind of satisfies your question a little bit, and I'm happy to discuss it further.
Thank you very much for that explanation, Emily. It's a gray area, you rightly pointed out. Refer page 5, everyone, now of safety. I've given you enough time to assimilate these questions. Now, did you ask yourself, who will be the person? Will it be a supervisor who will ensure all the barriers are installed at cash counters and pickup areas? Will it be your senior team leaders who will be ensuring all the barriers are repaired? So it's one thing having someone installing it. It's another thing ensuring those barriers do what they're required to do. That is to stop people from visiting those areas. If the barriers are not good enough, they're not strong enough, or they needed repair and it was ignored, what's the use of having it? So A, who will be doing it? B, who will be inspecting it? Critical. Ask yourself these questions like, who will be putting in the physical distancing markers on the floor? And with the weather changing and we're getting closer to winter, the marks will not remain there forever. So you need to keep on ensuring that those physical distancing markers are very much up there, and to see to protect your customers, to protect your staff as well while they're entering the facility. So now who will be doing all of that, and then who will be and what are your protocols for number of people seated at number of guests seated at the table, and how many people are allowed to be seated at the table, and identify all of that and mention all of that. And just imagine being a customer. I see all this advertised on the board outside your hotel. I said, wow, what a place to come to. They care about me. They needn't have shown me the plan, but they're so open. They're telling me this is how they're planning to protect me and my family for enjoying the experience of coming out and dining at a hotel and making it more memorable and safer. That is the whole purpose of having a COVID-19 safety plan, to make everyone win. It's a win-win situation. So, control measures and physical distancing protocols, page number 5. Still on the same page, page number 5. How many people will be allowed to sit in a patio? Identify, put in a number. You can do your calculations with the distancing requirements and other requirements. And staff meetings will be held following social distancing protocols. Mention that. Tell them, tell your customers, tell your staff that even though we have physical staff meetings, we will be following all the social distancing protocols. We'll be having masks on. We'll be doing whatever we are required to do to keep our staff safe, because at the end of the day, that keeps you as a customer safe. And then QR coded menus. I'm 100% sure that almost everyone on this call is doing that. That's become a no-brainer in the COVID age. Try and reduce the physical touch. Try and reduce these physical printed menus as much as you can. Try and allow people to scan a QR code to read the menu so that you avoid touch. And have some extra masks, PPE stored. Hand sanitizing stations need to be installed and at prominent locations, and the pickup counters and restrooms. Basically, what are your control measures and social distancing protocols? Use this section to communicate that both with your internal and external customers. That's as far as this is concerned to page number 5. Let's move to page number 6 now. Part of this is on page number 5 of your safety plan, and the other part is on page number 6. That's training and communication.
Sorry, Adi, can I just step in on one thing here?
Mm-hmm.
So one thing that and it's, again, I think something that's overlooked often. So if you have a guest, individuals are sitting at a table at your restaurant and they are not wearing their masks because they're consuming beverage, by law, the server is supposed to be wearing a mask and a face shield. So if the guests are not wearing masks, the server is supposed to be wearing a face shield. This is something we got clarification from the government on, and something we believe a lot of, I mean, I haven't seen restaurants necessarily, a lot of establishments doing it, but it is one of the requirements. So just a reminder on that when you're going through your plan to have those face shields for the restaurant servers.
Thank you so much, Emily, for bringing that up, because if you notice, that's point number 2 here, very much on the screen. And I'd like to share something that we heard from Jules Onsgray. Jules is the director of OHS inspectors. And the reason behind that law that you're saying, that the face shield over a mask is more because of protecting your eye because of the droplets, because a very small load of viral load of the droplets is enough to actually infect. And good point. And there is a question to clarify. Someone wants to clarify that if goggles are acceptable as well as shields or only shields, they have to be face shields. So as long as you have those ones covering the entire eye from and touching your skin, ensuring that the droplets don't go from, like, I'm wearing my specs right now, droplets can go in from here, from the sides. So as long as you cover them completely and they meet the requirements of the eyeglasses as set by the Ministry of Labor, you should be fine. Thank you for that question. Training and communication aspect of safety plan. Again, who is accountable? Who will be the person training all your staff members and using the personal protective equipment? Okay, so supervisor or manager, who will be the person ensuring all your staff, like Emily said, all your staff must be wearing a mask and a face shield, regardless of whether your customer is wearing one because they're consuming food and beverage or not. And because they will be getting closer while serving, right? Unless you're trying to use drones with a tray to go and set it. You don't want to get that experience, right? So you'll be getting closer and closer to the customer. So you need to ensure you do that. But who will be the person who ensures that? It's not no good having this in your plan, enforcing it and ensuring that someone is doing it. And then who will ensure all the disinfectants used in the premises are approved by Health Canada? How many times, let us ask ourselves a question, how many times have we gone to our kitchen or in our storage area and seen empty chemical or unlabeled chemical dispensers with some kind of a cleaner? And I just use it because I know for a fact there's a cleaner inside. Avoid that. There are VMIS requirements that you need to take care of. Ensure that your cleaning equipment are approved by Health Canada, and all your staff are trained on using them, and the VMIS requirements are taken care of. And who's going to be the person doing that? And the opening manager should ideally ensure all the windows and doors are open before the service begins to facilitate cross ventilation. It's a key factor. So this is your section to tell your customers and your internal staff about your COVID-19 training and communication requirements and how you're planning to protect your workers and PPE. I'll just leave you with this for about 3 or 4 seconds. I see another question that's come in. Someone says, please advise where it is noted that face shields are required for servers in restaurants. Does that also apply to banquets and events in halls and hotels? Emily just pointed this out very clearly. And Emily, you can feel free to join in to answer this question. Yeah, Emily, I'll give you.
Yeah, thank you. Thank you for the question. I'll pull the section of the reg and have it sent off to you. Our understanding is, yes, it would apply to banquets and halls and events because it's the same concept, but let me clarify that. And if anyone has a similar question, would like to know the part of the reg, then just flip me an email and I'll get that for you.
Awesome. So thank you so much, Emily. But just I'd like to add to this, and then I'd like to ask everyone on this call. I'm seeing so many leaders on this call, senior managers and directors. My question to you is, what's important to you? Working towards a safety culture, or just working on regulatory compliance? Just basic regulatory compliance is not good enough. So even if, let us say for an instance that regulation may not require something, why don't you want to go above and beyond and follow something that's more of a best practice, which pips something like a regulatory compliance and which is above and beyond compliance, and ensure that at a banquet hall, serving drinks, your waiter, waiting staff, are going to get close to customers for sure. Why don't we have a mask to ensure their own safety and the customer's safety? So ask yourself these questions. That's the whole purpose of having everyone on this call. Think about building a safety culture. That's more important than just trying to comply with the regulations. Let's now move to page number 7 and 8 of the COVID-19 safety plan. COVID-19 case management at the workplace. We're coming towards the end of the safety plan. Until now, it's been all proactive. Now, unfortunately, you have to learn about more of the reactive aspects of COVID-19 safety plan. What are your procedures to handle an illness at a workplace? This is your section to explain on page number 7, everyone. Let's move to page number 7, please. In this section, tell your external customers as well as internal customers, your employees, staff, and customers. Tell everyone what are your procedures to handle your illness at work in case someone comes to work unwell. Who is responsible? Is the duty manager who is informed immediately about the symptoms, or will 911 need to be called if there's shortness of breath or unconsciousness or something? What are your protocols about isolating the person? Where will the person be waiting until they get their ride back home? Think about all this. Who's going to be responsible? And who's going to be sanitizing that area, affected area? Someone needs to do that, unfortunately. So if that someone is a senior manager or a worker, has he or she been trained on wearing the right equipment to ensure that they don't get infected by any way? Are they properly equipped to clean the area? Do they know how to safeguard themselves while they do that? Ask yourself all these questions. This is your section to mention all of that and think about all of that. Let's now go to page number 7 again, and let's continue with steps to handle a confirmed COVID-19 case. Again, accountabilities, accountabilities, and accountabilities. Simple as that. Who is the person accountable to inform the public health? Emily will inform public health. Addie will complete the workplace assessment. Then Mary will report to the Minister of Labor and Skills and Training Development, along with the health and safety reps or JHSC representative. And Adrian or John will inform all the staff members. Why is it important to do what I just said? Because when you have all of these accountabilities mentioned in the communication protocols and your screening protocols, remember I spoke about the accountabilities there, you're going to see the advantage now. So God forbid you have a COVID-19 outbreak or a case. You don't, and you, a Minister of Labor inspector visits, you don't need to worry about who's going to be informing whom and who's going to be giving your screening records. You know exactly who's doing what. You're going to ask, Emily, please inform public health. Addie, do the assessment report, please. And John, can you report to the Minister of Labor? And Mary, can you please report to the staff members? And Adrian, can I see the screening reports for the 14 days, please? I need to see who needs to self-isolate and who needs to be told. That's as far as that is concerned. Now, page number 7 and 8, part of it is on 7, part of it on page number 8 of your safety plan. Steps to handle a confirmed COVID-19 case at a workplace. Very simple, you inform the public authorities. Who is the person accountable? It's all about the accountabilities. Who will be the person who will escort the staff member and ensure that the staff member is safe and their other staff members are safe, and who will be the person who keep in touch. Mental health, such a critical factor in that we found out, especially during the last 2 years of the pandemic. Oh my God. If someone suffers from COVID-19, I'm sure all of you on this call will not leave that person alone. You have to tell that employee that your employer, your hotel cares for you. We will be constantly in touch with you, understanding your mental well-being and physical well-being, and see whatever we could do to support you to get back on track, because we treasure you as our employee. Do that. There are wonderful resources. You've got GTHA's resources. You've got online resources from the Ontario.ca for mental health. Go ahead, communicate with these people. Who's going to be doing all of this? This is your section. Again, if plan A doesn't work, who's going to be your plan B for managing each of those tasks? Page number 9 of is just about your measures to handle additional risks or hazards. If there are any additional risks at your hotel or a hazard, who will be the person who will ensure that adequate lighting is required, especially in those areas where lighting could be impaired, and PPE might be required in those areas. Look into these aspects of your COVID-19 safety plan. Try to train your staff on these measures. Training is crucial, and make people accountable for ensuring these measures are taken care of very easily. Page number 10 of the COVID-19 safety plan refers to safety plan effectiveness. Very simple. Now that you know, this is where your accountabilities come into play, guys. You know who's responsible for what. So for understanding effectiveness of screening, I'll go to Emily. Can you tell me what's the effectiveness of screening, and how many people are filling out the screening forms? How many people aren't filling out the screening forms? Same is the case. How many people are watching our social media feed, and how many and how effective is our communication protocol? Watch all of that, track. And when you have those people accountable, life becomes easier to measure the effectiveness of the plan. The plan is as good as it's implemented. Simple as that. So yeah, some important links and contact information. I won't waste your time on this. It's just an FYI. All these are there in your COVID-19 safety plans. And I told you one of the biggest resources is the link provided by our team in the chat box for GTHA. Use that resource for COVID-19, get as much information as you can. Let's now look at safe restaurant reopening protocols, and let's quickly skim through it and try to understand. These are basic protocols that everyone working in a restaurant should know how to prevent the spread. We all know that, right? That's important. And to help stop the spread, you need to identify and control the risks. And the people in, there are two types of risks, either person to person or surfaces or objects. You're all aware of all of that. But what you need to be aware of are the key risk factors of COVID-19 transmission. It could be prolonged exposure, close proximity, crowded places, closed spaces, forceful exhalation. You're covering most of this by PPE and other equipment, and I won't scare you with the requirements. I'm just making you more aware about the requirements. The hierarchy of controls is a critical aspect. It's very important for you to use the hierarchy of controls to choose the right controls for your workplace. This applies to all your workplace hazards. So first, go with the elimination strategy. Try and see if you can eliminate all your COVID-19 hazards. That is the most important one. If you can't, try and use substitution strategies. If you can substitute that particular hazard, if you can do something to substitute engineering controls like your changing of or putting in admin controls like your markers, your barriers and restricted areas, and PPE, face masks, eyeglasses. Look at the hierarchy of controls as one of the easiest ways to control the spread of the hazard. Personal protective equipment do not undermine the significance of PPE. It refers to the clothing and equipment used by you at your respective hotels. And what you need to know about your PPE is the correct use. There's no use having PPE if your staff don't know how to use it. Train them. Training becomes crucial. And put in some control measures alongside PPE. Just don't depend on PPE. While you have the PPE in place, ensure that there's some nice control measures in place. And it's always recommended to get your staff to wear their mask at all time, especially while at work, given considering their own safety and the safety of their customers. And also as an employer on this call, it's your requirement to follow the regulations of the Occupational Health and Safety Act. OSHA requirements are very clear. As an employer, you are obligated under Section 25 to take care every reasonable precaution and ensure that all your business units operating are taken care of and are following all your protocols. And if you're following a group safety plan, and ensure that you cover your hotels as well in that. And Emily already added on that very well. And ensure you share your safety plan with all the stakeholders. Do not be afraid of sharing your safety plan with the public and the customers who visit you, to build trust in your brand and tell them that you're a safety conscious brand. So that's as far as the OSHA requirements are concerned. Then post all the requirements. I've already told you that conduct virtual meetings, try and communicate, make intercom announcements. Don't be afraid of sharing information. Don't be afraid of gathering information and updating information. It's a tedious task. Do it. And when there is a potential case or suspected exposure to COVID-19 at a workplace, you know the protocols. And you know who to go to. Adrian tackles the communication part with the symptomatic person. John tackles the public health part. Emily tackles the self-isolation and other requirements. So then you know who's handling what part of the plan. It's a piece of cake, and that's the reason for having this plan. And for help and support, these are some of the details that you have, and dthawillgive.ca is your resource. You need help or training support. 4S Consulting Services is the official OHS partner of GTHA, and we're always here to support you. So during the COVID-19, we recommend all safe ways of training options and cost-effective options. So if you're looking at any kind of support in terms of training, we are approved providers, the Chief Prevention Office for JHSC certification training for Part 1, e-learning, and Part 2, virtual learning, and there are special offers for you as a GTHA members. If you're interested, my details are out there. I didn't want to waste any further time on this. With that, I end the session at my end, and we still have about 5 minutes left for taking up all the questions. So I have a question to my team. So I do see some chats and questions. Have all the questions been answered? Yes. So yeah. Emily, the whole purpose of this webinar was to ensure that your members understand. I didn't want to scare them with the regulations, and they can be boring, that you keep watching it. Employers need to know this, and they know what their obligations are as an employer. But what's more important for them to understand is what are the best practices of following it? What makes life easy for them to cover their aspects for due diligence? That's the whole purpose of this webinar. If someone walks in, you need to be able to prove your due diligence, that you're doing that. COVID-19 safety plan is a very good initiative and I really appreciate the Ministry of Labor and especially the ROA to make it mandatory for employers and not giving employees the option of a good to have. Instead of making it a must have, now they will think, and it'll force them towards a nice safety culture. So I'd like to know your thoughts while we wait for some more questions. Feel free to send us questions. Emily and I are here to answer as many as we can. And we do see about 26 participants. Emily still logged in at 11. Wow.
Yeah. So
a clap for that. And the reason I say that is it tells me how serious they are of occupational health and safety, how serious they are about safe workplaces and ensuring their workers are safe. Your thoughts on that?
Yeah, no, it's a great attendance here today, and thank you so much, Addie, for the very great thorough walkthrough presentation. I'm sure at this point all of our attendees have a safety plan in place, a draft. If you have any questions, please reach out to us. We appreciate it very much. We have tons of resources on the website. It was just recently updated yesterday. So, other things relating to COVID-19, such as, vaccination passports. We have posters on our website for that, any kind of government information, including a very thorough question and answer document, which was recently set out. So that should help you as well. But again, when you're going through any of this, when you're navigating the challenges which lie ahead, your industry association, the GTHA, continues to advocate for you. We're working with the government to fully reopen to full capacity as soon as possible. We are pushing for that. And all these things are ever changing. There's changes that are coming weekly, so we will ensure to communicate those to our members. And a lot of these changes will result in some changes to the safety plans as well. So we'll be sure to keep you well informed of that. A big thank you to 4S. If you need any training or have staff that's coming back on, they do have some great programs, like Addie was saying, which will get your staff back up to speed when they're coming back into the property. So being cognitive of time, it's now 11 o'clock. Thank you everybody so much for your time. And if there's anything further, feel free to email us at info@gtha.com.
Thank you very much, Emily. And just to reiterate, while we still have 20 odd people, we will be sharing this with you, the COVID-19 safety plan, as well as the, uh, the deck that I presented as a PDF. So it'll be great if you could share it through your internal communication with all the people who attended the session today, because that'll be very helpful for them to present to their respective teams, to make them understand the significance of why they're doing it and how to keep the community safe, community at large safe. So
Will do.
yeah, thank you so much, everyone. It's been a pleasure introducing ourselves and pleasure partnering with Emily as well as GTHA. Thank you.
Thank you. Have a great rest of the day.
You too. Stay safe, everyone.